Ruth Coker Burks is an extraordinary figure who became a symbol of compassion and bravery in the fight against HIV/AIDS in the 1980s. She wasn't a healthcare professional or a trained social worker, but an ordinary person who, through sheer empathy, became a lifeline for countless people. Her story is remarkable and inspirational. Ruth's journey began in 1984, during a time when the AIDS crisis was at its height in the US, and fear and stigma around the disease were widespread. She was visiting a friend in a hospital in Little Rock, Arkansas, when she noticed a door to a patient's room with a red bag over the handle. This marked the patient as having HIV/AIDS. Out of curiosity and compassion, she opened the door and met a young man who had been left to die alone, abandoned by his family and ignored by the medical staff. Ruth sat with him, held his hand, and comforted him until he passed away. This encounter changed her life. After that day, Ruth made it her mission to care for others suffering from HIV/AIDS who had been neglected or ostracized. Many patients had nowhere to turn as their families disowned them, and hospitals were ill-equipped and often unwilling to help. Ruth became a one-woman support system, driving patients to doctor appointments, bringing them food, holding their hands during their final days, and giving them the dignity of a burial after they passed. She even used her own family cemetery plot to bury over 40 people with AIDS when local funeral homes refused to accept their bodies, fearing contagion. Ruth would dig the graves herself, marking each with a metal plate, often being the only person to attend their burial. Ruth faced significant obstacles in her work. She received no formal funding, and she covered expenses out of her own pocket. Her efforts were met with hostility from some of the local community who feared she was spreading AIDS. Despite the social backlash, Ruth persevered, knowing these individuals had no one else to care for them. Over time, she was able to build a network of supporters who helped her with donations and resources. Still, much of her work remained a solitary, daunting, and emotionally taxing journey. Ruth Coker Burks' story of courage and compassion reached beyond Arkansas and has had a lasting impact on the way society views AIDS and the importance of empathy. Her actions brought attention to the isolation and discrimination people with AIDS faced and showed the need for both humanity and dignity in their care. Ruth's work inspired others to take action, and in recent years, her story has been shared widely through media, leading to renewed recognition of her role in the early fight against AIDS. In later years, Ruth's story gained broader acknowledgement with the publication of her memoir, All the Young Men, which details her life, her struggles, and the incredible people she cared for. Her impact is remembered as part of the legacy of grassroots efforts that eventually led to improved healthcare, education, and understanding of HIV/AIDS. Though Ruth isn't widely known as a historical figure, her influence is profound. She serves as a powerful reminder that one person, driven by empathy and compassion, can make a difference, even in the face of stigma and fear. Today, as society continues to fight for equality and understanding in healthcare, Ruth Coker Burks' story remains an inspiration for advocates, caregivers, and all those who fight against discrimination in health and human rights.